Zoom grant. And also anyone missing this opportunity for some reason, this resource will be available in the Zoom grant. And let me quickly introduce colleagues working in the King County. They are with me today here. My name is Wandosan Gabriel Michael. I pronounce he or him, older adults and healthy aging team program manager, and I am procurement lead for this specific RFP. And we have here Nora Erwin Stewart, pronounced as they or them. Nora is older adults and healthy aging community investment team lead and supporting today managing the Zoom room. Cherish Kronmiller, pronounced she or her, and Cherish is DCHS contracting and procurement specialist. Today, she is with us here, and at the later stage, she will give us some highlights how we can use Zoom grants when we apply for this RFP. Again, a very friendly reminder to put your name, your pronoun, and organization in the chat. That we appreciate. And one last reminder, we have a question and answer session at last. So if you have, any question you have, you can keep it for that point of time, unless you feel it's very urgent or sensitive question. My colleague, Claudine, will be there taking notes and managing these questions. Thank you so much for the support on that. Yes, so the agenda items that we will cover in this information sessions we will try to see what is VSHSL or Veterans, Seniors and Human Service Levy, a very high overview. And we also try to overview the SE4 Caregiver Connection and Support RFP. We will also cover grant application assistance for this RFP. And we will also cover Zoom grant. Cherish will come at this stage to take us through a Zoom grant application to guide us how to apply through that system. And finally, we will have a question and answer session. So as I said, if you have any question, we would appreciate if you could keep it for that time. And we also appreciate if you can put it in the chat. My colleagues can coordinate those questions to give you relevant and helpful answers. Just to give you a general overview about VSHSL, it's a 6 years property tax levy, which was approved by voters, I think, for the fourth time since 2005. And VSHSL has 4 funding areas or 4 funding population areas. One is veterans, service members, and their families. This is one area of funding population. And the second one is older adults and their caregivers. And the third funding population or funding areas are resilient communities. And the fourth one included in the current levy is regional impact initiatives that affect all the 3 populations together. And under this levy, we have 5 result areas. One is housing stability, financial stability, healthy living, social engagement, and service system access and improvement. And the current RFP, the Caregiver Connections and Support Strategy, or RFP, falls under social engagement result area. When it comes to funding, as you know, VSHSL raised funds from property taxes. That is 10% per 1,000 of assessed values of property tax. So in total, what we project in the next 6 years, the program projects to generate 551 million between 2024 to 2029. And in terms of fund allocation, 30% of the fund will go to veterans programs, and 30% of the funds will go to seniors, and 30% goes for resilient communities, and the remaining 10% goes to regional impact initiatives. That is how the fund allocated. But if you like to get more information about the VSHSL for a bigger picture, we already put the VSHSL implementation manual link in the chat. So you can refer anytime for more information in the bigger picture. And the guiding principle of VSHSL is to build and improve connections and community. So VSHSL is all about connecting provider, connecting programs, and connecting people. And when it comes to equity and social justice, our overarching goal is to ensure that all people, regardless of who they are and where they live, and have the opportunity to thrive with full and equal access to opportunities, power, and resource. So equity and social justice is key to the work of the levy and embedded as a governing principle throughout this RFP. When I come to the RFP section, specifically, just quickly to give background, data indicates that there are nearly 820,000 family caregivers living across Washington state, supporting seniors and adults with disabilities to live in their own community of choice. And out of this number, many of the caregivers are spouses or partners who are themselves aging with physical and mental challenges to provide the required support for their beloved ones. So that they themselves have a lot of challenges unless we provide resources and services to make them stay in the service they provide. And similarly, good number of caregivers are parenting children. They're parenting children while simultaneously they provide care for their beloved ones or older adults. As a result, statistics show that up to 70% of family caregivers experience symptoms of depression and isolation as a result of this burden, stress from day-to-day caregiving for older adults or seniors and adults with disabilities that contribute to a higher morbidity and mortality rate of caregivers themselves. The good thing is researchers show that there is a strong connection between availability of resource services for caregivers and reduction of burden and stress of caregivers. So the availability of supportive services and resources helps caregivers maintain their health and remain in their caregiving role over a long duration. With this background, with this motive, the RFP was prepared, and there are very important key terms in this RFP. The first one is when we say adult in this RFP, we are defining as a person who is at least 18 years old. That is an operational definition in this RFP for adults and care receivers and care recipients. A person who is 55 or older and or an adult 18 and above with disability who relies on the assistance and support of others due to physical, mental, or emotional conditions. So this is the definition of care receiver and care recipients in this RFP. Yeah, already they are part of the RFP, but just quickly, the family caregiver definition for this RFP, or for the sake of this RFP, a caregiver means a person who cares for or supervise another person who requires care or supervision due to disability, chronic illness, or a need for support in activities of daily living. Caregiver includes individuals providing care for family members of someone with whom they have an ongoing personal relationship independent of their caregiver role. So when we say family caregivers, it doesn't mean that necessarily there should be a blood relationship with the care receiver. The person can be a friend, the person can be a neighbor, but should have a personal relationship with the care receiver. That is the operational definition of caregiver in this context. And when we say senior, we are referring a person who is at least 55 years old. So that is the operational definition for our purpose when we refer seniors. When it comes to the scope of services or the scope of work for this RFP, the RFP clusters caregiver services in 3 different scopes. Providers can apply to one or more of these 3 service areas, but the RFP anticipates these 3 service areas. One is information, resource, and outreach to support family caregivers. So this is more of information and assistance, resource navigation, and any other methods that empower family caregivers to navigate these complex social systems by reducing or removing cultural literacy and language barriers that prohibit system engagement. So the first scope of service will be around this one. So any service around information and assistance, resource navigation, or any client-focused support to support family caregivers to navigate complex social system. That is one area for scope of service the RFP anticipates. And the second scope of service expected in this RFP is group activities to increase family caregiver social engagement and improve their skills. So culturally and linguistically appropriate support groups, workshops, or trainings for family caregivers that promotes social engagement and reduce isolation and stress and improve skills of caregivers. So these are the kind of group-based activities. And these group activities can happen in person or virtually, or maybe offered in tandem with services for care receiver, as long as the primary service recipient is the family caregiver. The third scope of service under this RFP is a respite option. Respite gives a family caregiver a short-term break for self-care or other personal needs by offering care and supervision for care receiver for a few hours a day or a few days a week. So there are different respite options out there, respite programming option may vary under this funding, but may include paid in-home care, which is a traditional one, adult daycare, or any other community-defined respite options that offer a break for the family caregivers. So these are the scope of services the RFP anticipates. In addition to, or as an integral part of these 3 scope of services, organizations may propose supplemental services to purchase DME and adaptive equipment to reduce the caregiver's burden by improving care receivers' independence and functionality. So this is also another area as integral part of the previous 3 scope of services. So providers can ask these flexible financial assistance or supplemental services. But the details. Okay. All details, including allowable DME, adaptive equipment, program requirements, and funding amounts. All that level of details will be determined at contract stage, but the RFP gives that opportunity. Providers can apply to purchase durable medical equipment. And the RFP is clear in terms of any proposed DME or flexible financial assistance proposal should ensure that no duplication of services with other publicly funded programs such as Medicaid or family caregiver support programs. So that is an important consideration when we propose any durable medical equipment, adaptive device, or flexible financial assistance generally. And when it comes to the RFP focus population, the focus population for this RFP are family caregivers of seniors and adults with disabilities, especially caregivers who are low income, BIPOC, living in rural area of King County, LGBTQ+, or from immigrant or refugee communities. These are focus population for this specific RFP. And the intended outcome of this RFP is to decrease caregivers' isolation, burden, and stress through increasing access to services, improving their skills and understanding, promoting community connection and well-being, so that caregiver can sustain their caregiver roles and support seniors and adults with disabilities to live healthy and independent life. So this is the intended outcome of the RFP. When it comes to funding, so this RFP allocated $3,859,016 for the program period of January 2025 to December 2029. So for 5 years, that is the resource envelope coming up with this specific RFP. And the King County intends to award up to 7 organizations using the funds available to DCHS for this investment area, using equity and geographic consideration to ensure services are responsive to funding priorities and community needs. So depending on the availability of funds, that is what we anticipate to fund around 7 organizations through this RFP, which is subject to change anytime. And applicants may request amounts up to $575,000 for the funding period, which is 5 years, or approximately like $115,000 annually. Applicants should only request what they can spend and should demonstrate that proposed spending plan through the budget submitted with the application. And DCHS reserves the right not to award all funds advertised in this RFP or subject to change. When it comes to eligibility, this request is open to for-profit, non-profit organization, community-based organization, tribes, and tribal organizations, public or government organizations serving communities in King County, small, non-profit, community-based Black, Indigenous, and other communities of color-led organizations are encouraged to submit proposals. But when it comes to specific eligibility, applicants must meet the following qualifications. The first one, must have at least 1 prior year of experience working with family caregivers of seniors and or persons with disabilities, including providing at least one of the service areas identified in Section 2, C1 scope of work of this RFP. So at least having experience, 1 year's experience of one of the three scope of services that we discussed. And the second one is submit a complete and timely application within the scope of the work of this RFP, as outlined in Section 2C, RFP Overview, the request. The rating criteria, this is the rating criteria in the RFP. Organizational capacity and experience has 13 points. Program models, already the questions are part of the RFP. So program model that providers propose, come up with, has 35 points. Equity, racial and social justice questions, they have 20 points. Budget and physical questions, they have 10. Data collection and evaluation will have 5 points. Total, the score will be 100. And if need be, interview can be incorporated in this process only if it is necessary. And that interview will have 10 points. When it comes to contract requirements evaluation, at this stage, providers are not required to submit a detailed, fully developed evaluation plan, but it's important to keep in mind there is anticipation to submit important data and reporting under this RFP. To speak specifically, these are data collections and reportings expected from this RFP. The first one is client level data will be collected for any activities, services provided. When client level information, collecting client level information is difficult for programs events. The aggregate level of data might be required or will be required, and also narrative reports also will be required in this RFP as part of data collection and reporting. When it comes to billing, the DCHS will effect a flat monthly payment for most billing periods unless negotiation and discussion happens. That is the regular way of payment, a monthly flat payment for providers. And every quarter, DCHS expects contractors or providers to submit a detailed general ledger and actual budget spending report for reconciliation on quarterly basis. And when I come to RFP timeline, this is a timeline already included in the RFP. RFP release date was August 13, 2024. And information session, which is happening right now, is August 20, 2024. Final day for small agencies to initiate request for technical assistance is September 10, 2024. I will come to this one. There is a separate slide to talk on this part, but the due date to request any technical assistance will be September 10, 2024. And the final day to submit questions will be September 17, 2024. If you have any question on the RFP, that this is the due date. You have to submit before September 17. And RFP due date is September 24, 2024, by 2 p.m. There is reason to make it 2 p.m. Cherish will talk to you about that, but my recommendation is it's always good to start as early as possible, since the system might be crowded at the latter stage. And responses reviewed and rated will be happened in October 2024. Interview with applicants, if need be, will happen in October 2024. Notification of award for award decision for providers will be provided November 2024, and anticipated contract start date will be January 2025. That is the effective date that we anticipate. Applying to the RFP, as I said, submit proposal in Zoom grant on September 24, 2024, before 2 p.m. How to apply through Zoom grant. My colleague Cherish will take you through the system to help you understand how to navigate the system and apply. But a complete submittal will include the following 3 documents. The first one is response to summary question, response to narrative questions, and the third one is a budget plan. The template is incorporated in the RFP under Zoom grant. So these 3 things makes the submittal complete. Zoom grant, all RFP materials are posted in Zoom grants. Please check regularly for any updates, including amendments and responses to questions. So whenever we received questions, we update the question part. So please go and check if there is any update on Zoom grant whenever you have some moments. Yeah. And all application must be filled out and submitted via Zoom grant. That is the best thing we advise. But for some exceptional reason, if we cannot submit through Zoom grant for technical reason, as a last option, as a last resort, you can send by email through the procurement lead. And questions and responses are received today, and those submitted in writing will be posted to Zoom grant and recording from the information session. And the RFP link, one of my colleagues can help me to put the link in the chat, so you can get the link for this specific RFP. Anytime you can go there and refer if there is any update. DCHS will not notify for providers when updates are available. So it's the provider's responsibility to look if there is any updates on Zoom grant. Appreciate it. And grant assistance, as I said earlier, we have providers have free support in grant application. Small organizations, small providers. When I say small organizations, I mean organizations having fewer than 20 FTE and operated in less than 4 million budget in the previous or in the prior fiscal year. That is what we mean by small organization. If you meet this criteria or requirement, there is a support in application of this RFP, but the level of support is not submitting the proposal on behalf of the providers, but providing technical supports for providers. And qualifying organizations should contact the technical assistance consultants directly before September 10, 2024. Not the due date, September 10, 2024. That is the time, the due date to request technical support from the consultants. And in the RFP, we included, as attachment E, we included the list of consultants that you can contact directly. And I believe some of the consultants might be in this call. So it's a good opportunity to form a connection. So with this, let me invite my colleague Cherish to take us through the Zoom grant system.
Great. Thanks, Mendoza. Yeah, if you stop share, it'll probably let me share. It's not letting me take over without you stopping.
What about now? If you try,
No.
doesn't allow you.
I think you're still sharing, Windowson.
Yeah, you're still sharing, so you have to stop your share.
Apologize.
Usually it's down. So if you go down to that lower bar.
I got it, I think, yeah. Sorry.
Okay.
What about now? Good?
Okay, yes. That's good. That's good. Okay, so everyone should be able to see my screen. Hello, everyone. I'm Cherish Cronmiller, as Windowson said. I'm here from the Contracts and Procurement team to help you get excited about entering and starting your application. So, so I put that thing, in the chat. If any of you want to share by giving a reaction down there, a thumbs up or a smile, laughy face, let me know it's your first time using Zoom grants. Some of you messaged me privately that it's your first time. Doesn't have to be a secret, but we're here to help. So, you would take the RFP link that we've got there, drop it into your browser, and it doesn't seem that Zoom grants seems to be play nicer with any specific browser. So if you come up and you're already logged in, or you come up, you're gonna see this information about the application. You sort of get a preview. Now, if you have a login, what you're going to want to do is use your login that you use to apply for applications. Now, keep in mind, whoever does the actual application, right? Whoever starts the application, that is the person who's going to have to submit the application. All right. So whoever starts filling this out, right, and they've hit the button to start that application, that's the person that's going to have to submit. So make sure that whoever is the initial one to start the application, that person is going to be around to hit the submit button, right? Because you can add collaborators, right? When you keep scrolling down past here, past where you see some of your information, you can see where you can add collaborators right here. And so you'd put somebody's email address, their information, title, and then give them editing access to be able to go in and add them to be able to see stuff. Now, you can add them to the contacts below if you want them to be copied on any emails that are going out. We don't often send a lot of emails. Sometimes we might send an email, reminding you if there's a frequently asked question guide that gets published or an amendment that gets published. But it's up to you to remember everything that's indicated up here in this release, right? And so one of the first things I tell folks is, hey, go into your Outlook calendar, your Google calendar, get these dates into your calendar to remind you when is the last day to ask questions, or when is the last day to be able to talk with the folks who provide grant assistance. Okay, so just a reminder again, these folks that you add down in collaborators, they can help collaborate, but they cannot hit submit on the application. Okay, they need your login and password in order to do that. So if if you're already logged in, you want somebody else to be the applicant, you can do that. Just make sure you're entering into the right program. One of the major things that I first recommend is just get in there and start looking at it. All right, that's the number one thing. People get so nervous, they put stuff off. Don't do that to yourself. Give yourself a little treat and say, hey, I'm going to go in, I'm going to look at these RFP documents. And what some people like to do is they like to download these documents, right? The benefit of downloading those documents, you can click on them and then your system might say open or save as. I'm just going to open to look at it. This allows me to look at the entire RFP, right? And all of the information that Wendosa went over is available here. And you can read back through it, read back through information, what the request wants, eligibility, things of that information. Back to the library, here again, you can see the important part, what I think, the narrative questions, okay? And this downloads into a Word document. We make that simple for you so that you can go in and you can work with your team to answer some of these questions. And I sometimes recommend going ahead and filling stuff out using the Word document. The reason I say that is because Zoom grants, when you're working in it, depending on what is going on, it sometimes doesn't play nice with saving information. Often these types of things, you'll start to fill in information, legal entity name, right? And see how that you got that little saving screen for a second. Sometimes you'll get that saving screen for a long time. And when that's happening for a long time, it indicates that the system is sort of backed up or having problems. What you'll also find is that if you wrote all of your stuff in another application, which I always recommend because, that way, no matter what happens with your saving in here, or next year comes around or somebody's looking for those grant things, right? It's really helpful to be able to find your old document that had all that information in it. Now, what you can do in a lot of programs that Zoom grants doesn't play nice all the time with is often you can copy and paste from one, right? So if you are typing in Notepad or Word and you select everything and you try and paste it into Zoom grants, sometimes that'll work, but a lot of times, unfortunately, it won't sometimes. So best thing to do is type everything out into your Word document, answer all of these questions, right? And when you're using your Word document, you can always select your word amount, right? And then you can find out, you can do a word count and you can see how many words or characters you've selected. So as you're typing out, you can start to see how many characters or how many words that you have. That's helpful so you don't start to go too far down a track and then realize, oh, I'm already past my numbers of characters. And so looking through and watching those, word count is here, and you can select that when you've started typing and entering into that document. So because there are character limits, and that's to help you out, right? So that you're not waxing poetic about stuff, but not painting a picture, right? So I always say, and just, a reminder with these applications, the evaluators, you want to write this as if somebody knows nothing about your organization, right? They don't know anything about your organization and they don't know anything about the work they do. So you don't need to write fancy. You don't need to be all complex and Shakespearean. You just need to paint a good picture of what it is you're going to do, how you're going to do it, why you're going to do it, and what's your experience in doing it? What's your background? Who are the folks you have, right? So answering these questions, always go back or maybe have somebody else look at it and say, did I actually answer this question, right? Because when an evaluator is looking at this, they're looking at the question, they're looking at your answer. Did you answer the question asked? Did you paint a picture and describe really, who you're serving or how you do your service, right? It doesn't need to be so fancy. What it needs to be is understandable and clear and concise, and have that ability to answer the questions and tell somebody about your organization and the work that you do. Okay. Now, in the going back to the Zoom grants, make sure you realize that there are and these are some jump links here, they'll get you between sections. There is district maps there, and the consultants are listed there in attachment E. And what I was looking for, and I'm not seeing, is our Zoom grants tips and tricks. I can look for that or make sure that we get that posted up there for you folks, to make sure that you can see that, because there are there's a Zoom Grants University. So you can actually sit and go through that if you need to, and be able to sort of walk through doing an application. So make sure you're typing directly into boxes. Try not to, use any specialty symbols or text. Make sure you're watching that save button and that what you're typing in is getting saved. Always recommend doing it on an outside document, so that you do have it saved in case there is a glitch in the system. There's a reason why we close these at 2:00, and it's because Zoom Grants is on Eastern time. And so when people panic or have issues as they're submitting their applications, we want to be sure that Zoom Grants is open in case there's an issue. But the benefit, again, is if there is some type of crisis and you've typed all of your answers into the narrative Word document, at worst, you're going to be able to send that forward to us, that you answered everything, that you've got your budget done. That rarely happens, but, available. We want to make sure that, this system is available to, all nonprofits that have the ability to do this work, or agencies that can do this work. So just go in there, get started, start filling stuff out, maybe assign different sections to different folks, right? So you're not taking on everything all yourself. You'll see here with budget, we're just having you, and there's instructions. Yellow stuff gives you instructions. When you come over here to documents, this is where you're going to upload your document there in the system. And so you'll always be able to go back out of the system, and then you'll be able to see what your incomplete applications are that you're working on. And then you always click on the application ID. That's your specific ID for this application that you're working on. And there again, you can always see the information. We will later on post the link to the recording of this session. And then we'll make sure that our Zoom grants tips and tricks are up there as well. But you can always, reach out. And then you have some folks that are grant assistants. Some of them have made comments in the chat. And again, that list of grant consultants is available here. Reach out quickly to them if you think that you've got some questions or you need some help. They're there for that guidance. And so use that, because it's there for you. And it can be really helpful in making sure that, you're answering stuff correctly, and you're filling out the information. They've helped folks through this too. So very helpful in that regard. Happy to stick around for a few minutes. My colleague Shannon Brooks is in the chat. Just put the Zoom tips and facts available on a link there for you. So if you have questions in that regard. But again, my number one thing is get excited, get in there, get started, right? Add stuff up to your calendar. Just even fill in a couple of things and then tell yourself, hey, I'm going to go in there and I'm going to get these 5 questions knocked out, right? And then I'm going to go and treat myself to a lovely dessert or something, or a really nice dinner, and reward yourself to get yourself in there and not wait until the last minute, because the system gets plugged up at the last minute. We see people frantic to get stuff saved, and they say, oh, we're trying to hit submit, and it's going around and around because we've got all these apps trying to submit right at 2:00. So don't be that person. You've got this, you do this work. So get in there, put your application in, and we thank you so much for your service to the community.
Thank you so much, Erish. That's very, very much helpful. And yes, just kind reminder, if you have not yet put your name, your pronoun, and your organization on the chat, we would appreciate just a very friendly reminder. And yes, here we are for question and answer. And I see a couple of questions on the chat. So probably we can start answering those questions. And if you have more questions, you can unmute yourself anytime and ask, or you can put it on the chat. So the first question I see is from Taylor, asking that if we do all three, should we apply for one primary? That is, we provide respite primarily as well as caregiver skill building. So, I mean, the question is like, let me go quickly. Let me share my screen. So this is the scope of services recommended. So the question is, if we take this one as a primary and can apply for the others. So as the RFP clearly guides, providers can apply for one or more than one service areas depending on their model. So whatever model you come up, that's totally fine to apply to one of the service areas or more than that. We don't require providers to apply for all the three as mandatory thing. So providers can decide their program model. So still, it's part of your program model. But yes, the RFP allows providers to apply to one or more than one area of this scope of services. And as I said, it's all about your program model. But in terms of allowability, that's totally fine. And I saw request from Makina asking about, is this RFP works with working with seniors supporting children, and the RFP part, specifically the focus population is family caregivers of seniors and family caregivers of adults with disabilities will be a focus population for this RFP. So family caregivers of seniors, when we say seniors, we mean family caregivers of 55 and above, and family caregivers of adults with disabilities. So we mean anyone 18 and above. So by that definition, it doesn't include seniors providing support for, caring support for children. think I see another question. Our services are delivered on as needed monthly basis. We don't have fixed overall budget for the entire year or award period. In this scenario, would it be appropriate to suggest including not to exceed total amount requested? If so, could you provide guidance on how to best to approach this in our submission? So our services are delivered on as needed monthly basis. We don't have a fixed overall budget for the entire year or award period. In this scenario, would it be appropriate to suggest? Yeah, okay. My colleagues can come in to comment on this one as well. Nora, can you come in to comment on this one if you?
Yeah, sure. So just to clarify, although this is a procurement where we are awarding 5-year contracts, we will still only have access to 1 year of funds at a time. So we do need you to do your best to estimate your annual budget per year in your application. So some details can be worked out during contract negotiation, but overall, we need annual totals for each year in your budget.
Thanks so much, Nora. And I see another question asking about applying jointly. That's from Maria. We have 2 organizations who will be working side by side on a project we are proposing, each with different strengths and experiences. Is it possible to apply as co-applicants? I think, Nora, unless you have a different approach, can we answer this one in writing as part of, or do you like to react here? What do you prefer?
You could only, I would say we only make awards to one contract holder. And so one organization would need to be in a position to subcontract with the other organization. So if you are looking to have your own funds, you should apply separately, and you can certainly reference the work each is doing. But we would not make an award that is shared by 2 agencies. So if that answers your question, Maria, let me know.
Thank you, Nora. That's clear.
Okay.
Thank you, Pops. And I see another question. Can King County assist with translation service for non-English speaking caregivers? That's from Taylor, I can see. And what do you mean by assisting? So is that requesting to come up as a program, or can King County assist with translation service for non-English? Taylor, can you move and say a few more on this question?
This is Cecily from Old Friends Club. I think one of the questions, it's Tyler is also from Old Friends Club. I think there's a question about, I don't know if it was, and Tyler, let me know if I'm wrong. I don't know that it was translation services, like if a caregiver comes in and is not, there's a language issue. I think it's more that part of our potential writing of the grant is regarding some materials that we have, and whether or not there might be a possibility of King County's having those resources to translate those materials. And I seem to remember that at least at a previous RFP, that was a possibility, but I think we're not sure. So we just have a question about that. Did that
Okay.
make sense? I hope.
That totally it makes sense. Yeah, I think
Okay, thank you.
yeah. So we have resource in King County for translation of documents, translation of language as part of technical assistance, technical supports whenever providers required. If you have that kind of request, we can link you up with the right section in the person. But yeah, Nora, do you want to add on this one or?
Yeah, I would say that fund is quite limited and tends to be exhausted each year before the year is up because it is available to all eligible VSHSL contract holders. So I think if it was a one-time expense, you wouldn't necessarily have to build that into your budget, but if you anticipated it being ongoing, I would go ahead and include it in your program budget that you submit.
So not necessarily that it would be King County's ability, but we would be able to put that in for a potential vendor or contractor that we would use.
Yes.
Is that what you're saying, Nora?
Yes,
okay, great.
Yes.
Thanks so much.
Sure thing.
So I don't see other questions. So yeah, so for any additional questions, clarifications, please feel free to write for email already included in the RFP. So we will get back to you. I mean, we will include that question in the answer in the Zoom grant. And yeah, let's know anything what we can support in this process anytime.
I do see a new question in the chat, Windowson.
Okay.
Do all 5 years need to be budgeted at or below the 115,000? With the 5% COLA, will the final budget for all 5 years exceed or equal 575,000?
You can go with that if you like.
Go ahead and answer.
Yeah, Kerry.
Okay. So the total budget will equal or not to exceed 575,000. We understand that might be a complex math budget to build. And so if you want to just divide it by 5, when we go to contract, we will adjust the annual award amounts accordingly. But the total ask for all 5 years should not exceed 575,000.
Thank you so much, Claudine, for putting the email address. So if you have any additional question or if you need any more information in this process, feel free to write in the email provided in the chat from Claudine.
And we do have a little time left for this afternoon. If anyone still has questions and wants to come off mute and ask them directly, that is fine too.
I will, if I can further elaborate. The two organizations are both here on Vashon. Vashon Care Network has years of experience supporting caregivers, and we have contracted with them before to do scholarships for home care aides. So, but the senior center itself, other than that subcontracting, doesn't have a full year of experience doing specifically caregiver support. So we want to continue helping them do their work and do other work as well. And I don't even know if you guys can answer that. What I'm struggling with is who's the strongest applicant? You know, you probably can't answer it. What we have is a staff. And the ability to do the financial part, the budget, the contracting, the supporting, hiring new staff, and they are completely volunteer run. So that's what I'm struggling with, to lay it all out.
Yeah, that's definitely something to decide internally at your organization. And, I would just go and consider whether a subcontracting relationship might be the best suited arrangement in your case. I don't know, all the particulars, and we can't advise on
No,
that.
I know you can't. I know you guys can't.
So
Yeah. Okay, we'll talk more. Maybe we'll email other questions. Thank you very much. Just wanted to articulate it.
Thank you, Mary. Okay. Thank you so much for coming to this session. And as I said, this session was recorded, so you will find the recorded material on Zoom Grant anytime when you want to refer back. Have a good one.
Thank you very much.
Okay, bye.
Bye.